So we are here today in Sintra to organize a think tank on innovation pathways on healthcare. And for that, we collected the best experts on healthcare of Portugal.
So looking at the innovation pathway, especially in such a regulatory framed environment, it's very important for us because nowadays we see that the way people build startups and build companies and test them on the market is changing in all different sectors. Even the oldest sectors are getting faster and faster to build companies and test them on the market. And here we have a very interesting dilemma. It's protect the public, protect the user, but at the same time bring them the newest technology and the best healthcare services as fast as we can.
Portuguese SMEs are very committed to health, or health SMEs are very committed and very interested in the European programs. Mostly they go for the SME instruments, so there is the tendency for them to go to use instruments that are more directed to companies instead of going to the collaborative research health projects.
There is a need of increased awareness about this phenomenon, that patients can contribute to innovation. They have not only ideas, but they can do the prototype, and with the help of engineers and other people can develop products that are very interesting. So this part is very important, and try to put the patients inside the equation when we are talking about innovation. Now we talk about patient empowerment, the self-management of the disease, but also in innovation, patients can be very important players.
First of all, we need to define the clinical and the industrial need before we get into the project. We need to clarify the need. The second thing is that we need to have a multidisciplinary team to look at the need and to develop a solution that maybe is not about technology, it's about change management or anything else. So we need to have a multidisciplinary team so that we can solve the need for the industry or for the clinical persons.
We need more funding at an early stage, at the ideation phase, because so innovators and startups can actually get to the phase of the prototype and actually test their ideas, their solution, physically, so to speak. Making sure that hospitals in Portugal have an innovation department, because not only that would help to adopt more innovations, but at the same time it could be a new revenue stream for those hospitals and to better manage clinical trials as well. And then finally, I think the regulators should have a more active role, an active role not just in the regulation being in the forefront of innovation and understanding it, but at the same time in communicating changes, for instance, the new medical device regulation, so they should really be more proactive in that sense.
We need to focus on value-based innovation, so we need to work to better understand what are the unmet needs in Europe in terms of health, and we need to focus on finding solutions to solve these unmet needs. Moreover, we also discussed a lot about the creation of innovation ecosystems that are able to support a fast proof of concept of solutions, and that allow us also to kill very rapidly solutions that are not able to solve these unmet needs.